Welcome, everyone. Today I'll be talking to my close friend, Aidan. Aidan and I met in college where we were on the rowing team together. Aidan majored in physics while also on the pre-med track and taking several classes in linguistics. After graduation, Aidan got a master's in science in biomedical engineering, and he worked in a lab during his grad degree and has worked in a research lab in Cambridge in the last couple of years doing drug discovery in neuromuscular diseases. Aidan grew up in New Hampshire, considers himself a very free man, and we still go running and hang out frequently. All right, Aidan, anything else I might have missed?
Nope, that's my life.
Perfect. All right. Yeah, so I think what I'd love to start with is talking a little bit about your early years and maybe starting with some of your academics in high school and kind of what drew you towards some of the academic paths that you're still on now.
Sure. Yeah. I mean, like Alex said, I grew up in New Hampshire, youngest of six, actually. So I have five older siblings. High school, I took basically every math class that was offered instead of taking like world history and so on. And then eventually, I took both AP classes in calculus and then took AP in English. And also I took AP French. Mostly because I was hoping whatever college I got to, I would be able to start more advanced classes earlier. I took anatomy and physiology, which I thought was pretty cool because we did dissections and so on and so forth. Always been kind of intrinsically motivated. I think probably that comes from being the youngest of six, where my family is very supportive. They still are. But with so many people in the family, I had a lot of time where I could just kind of be to myself. And I think that's what I really learned what I enjoyed doing, and that kind of followed me through high school.
Do you think anatomy and physiology was one of your favorite classes that you took in high school, or what do you say your focus was kind of going into the beginning of college?
Yeah, I mean, I loved anatomy and physiology. I think biology is generally just so crazy to me that it works. I'm going into college, I was really kind of like, I was like, okay, I'm going to be on the pre-med track, but I knew that there were other things out there. I didn't really know how you achieve them. It's just like a matter of time and being exposed to it. But I also think an important thing is like, you really learn that a lot of stuff is self-directed. Like nobody's going to tell you exactly what you need to be doing. You got to figure it out on your own. And I think you have to be exposed to things that are very different to be able to tell like, oh, I enjoy this, I don't enjoy that. But definitely I knew I wanted a major that did a lot of math, and I knew the biology major didn't necessarily include a lot of that, even though I was also interested in biology. I didn't even really at that point know how biology and math went together, which is eventually actually how I ended up going for my master's in biomedical engineering, because I thought that that would be a good path to combine those two things.
Jumping off of the math and sciences track, did you have an idea when you were in high school or maybe the early years of college where you wanted to go with those?
Yeah, I mean, I kind of always knew. So my oldest brother and his wife at the time were both physicians. They both went to medical school. And then I also spent a lot of my time with my family taking care of my grandmother and interacting with her physicians for her care. So that really, in a nutshell, is what exposed me to medicine and really got me interested in medicine, because I could see it wasn't also just about the biology, but it's also about like how to translate all that knowledge into actual like practice and impact. And that's something I've always been focused on. It's like I don't want knowledge for the sake of having knowledge, which, in its own right is important. But personally, I like to do things with what I've learned, which is also why I, got into research as well. But I always kind of knew medical sciences, medicine was where I would end up.
So going to undergrad a little bit, focus on physics with some of the math and biology and chemistry going on in the background. Where do you struggle most? Where do you say some of your hardest classes were in?
Physics.
Okay, fair.
Yeah, it's so funny actually. So in high school, we had to take, biology, chemistry, and physics to be able to graduate. And then they gave us basically a year to, or maybe a semester to, no, it was a full year for additional exploration. And I kept putting in physics off. I took it senior year. I knew I didn't want to go to engineering school for undergrad right away. I took physics in high school, and I actually really struggled with it. Like, it didn't make any sense to me. And I know it's easy to blame teaching methods, but I also think that it was just such a different way of thinking about things. And even though I was good at math, physics is an example of like putting math into practice and realizing what math you actually have to be doing to actually answer a question. And I just totally struggled with it. I was like, this doesn't make any sense. So part of me was like, I want to, kind of change the narrative a bit here. I know I can do biology. I know I can do chemistry. But like physics was this kind of mysterious thing to me. Also, I think just the jump from high school to college in terms of expectations around what you're supposed to know and how you're supposed to study, it's different for everybody. But like for me, it was a huge transition. So that on top of physics just being a difficult subject to begin with, like it really opened my eyes. I'm like, okay. But I was like, there was something about it that I always found interesting. So I wanted to keep going with it, even though I literally got a 42 on my first exam, which with magic of curves made it a B.
I was about to say I took that class a couple years later, and the curves were hefty because most other people were getting 40s and 50s as well.
Yeah,
for better or worse.
It was just extremely difficult, and it was all very much self-directed. Like you got a textbook, there were questions, you didn't have the answers to them. You just had to kind of try to work through the problem and get to a solution. And you don't really know if your solution is correct, but in physics, it's actually more about the process than it is about the final solution. And then also the other thing is in physics, especially in the collegiate physics, it's like they don't put numbers. You're dealing just with variables. So it's very abstract. You don't have you're not calculating, oh, the answer is 5. You're calculating that the answer is some kind of formula that you would then put measured values into. So I got into physics because, I struggled with it in high school, and I found it to be a challenge. And it was the perfect amount of math that I wanted to. It was a path for me to learn more math and then also hopefully learn. But physics was definitely the hardest. I actually feel like I learned a lot about how to approach problems. I think doing a physics degree did more for my critical thinking ability than it really did for obviously my physics knowledge. Like I have rudimentary physics knowledge, but even to this day, some of the concepts of it, it's like I have trouble wrapping my head around it. But I think it did teach me to focus on, and I kind of use this approach in my job now, and I think I'll continue to do it in the future. Just like thinking on what's the most essential thing, like making as little assumptions as possible, understanding all the different components of a problem and how they're related to each other, and then how to actually go through analysis to figure out your next steps, having kind of as much of an impartial perspective as possible.
Yeah. I think most people who take physics would agree wholeheartedly that some of those concepts are really hard to wrap your head around no matter how much you try. So I don't think you're alone in that at all. Some of those problems I know for a fact also took hours and hours to solve, and you stuck with them through several different courses. So where would you say some of that inspiration to keep pursuing physics came from?
I don't know. That's a hard question. I've always been pretty driven, and I'm very goal oriented. I like having things that I can achieve, and I like being challenged. So I think the fact that it continued to challenge me and that it was something that I couldn't do easily, that I wanted to be able to do easily, that's what really pushed me. And just like the satisfaction that you get sometimes from completing it, it's like, okay. And that's how I know being in research, it's very similar. It's like you're failing. I mean, mostly it's very humbling because you think you know so much, and then you run through a process, and then you're like, I'm actually completely lost, and I have no idea what I'm doing. So I think having that dose of reality constantly, but being willing to stick with it because it's satisfying if you do reach that point. I think that's really what it is. But like, I've always been that way. I don't know where it comes from.
Yeah, so I think that's probably a good point then to go and dive a little more into the research stuff. So you did a little bit of research undergrad, is that right? I remember going to your thesis presentation at some point.
Yeah, I mean, I was in a lab for almost 2 years actually.
Oh wow.
What was it the most productive in terms of data results? No, but I think it's not like I was even trying to necessarily achieve publications or any particular thing. I started doing research the summer after my sophomore year of college. I spoke to pre-med advisors, and they're like, oh, well, research looks great on a medical school application. And it's like, but you should really not be doing things to check boxes on applications. Like, you should be doing things to be able to learn about what they are and whether you like them or not. And obviously, I'm continuing to do research to this day, so I obviously got a lot out of that experience. It wasn't productive and productive in the sense of accomplishing external things, because I think you don't realize, like, most projects in science fail. Like, they don't work. Like, you have a hypothesis and you test and you try to develop, methods and ideas of how stuff works. But like I said, it's very difficult, and it humbles you. You have these ideas and you try to test them. And especially with what I was working on, we had very limited resources. So I think we tried to be very clever about what kind of data we wanted to collect. But yeah, I think that really first exposed me to how science is done in a professional context, and what role as a learner you have, because it's hard. Like, these techniques are not straightforward. You're on the cutting edge. You're doing things that probably nobody else is really doing, and nobody's there to really tell you how to do it. So you just have to rely on literature and past experiences and the anecdotes from people around you that you trust to be able to really try things and push forward. And I mean, even then, things cannot work. But when they do work, it's like pretty fascinating, because you're observing some part of nature that like you've directly interacted with, which I feel like is pretty meaningful, at least for me.
Yeah, I think that's a really good way to put it. I think it'd be interesting as well to explore a little bit about your time in graduate school. So tell me a little bit about that. What was that transition like? How do you even decide on biomedical engineering versus maybe some sort of physics graduate, or going straight into medical school or anything like that?
Yeah, I think I had an experience very similar to a lot of people who are graduating college, where it's like, I know what I'm vaguely interested in, but like, I'm not 100% set on any particular path. I loved doing research. I loved reading literature and trying to build experiments. Once again, it was another situation where I failed so much that I was like, I have to be able to accomplish something in this. Like, this is just, I can't put this away. And being on the cutting edge was really cool. But I chose biomedical engineering because I knew, like, I worked with students who were in the physics PhD program at BC, and I saw what they were doing, and I knew for myself that was not what I wanted to be doing. I knew I wanted something that would be more medically relevant, something that could interact more with the clinical world and get closer to having a direct impact on people. Not that what they were doing doesn't, but what they were doing is very, very too abstract for me. I couldn't do it. I needed to have distinct problems that have some pathway to being solved, which I think medical things have, at least for my mind, have a much more straightforward path. So I applied to master's programs, chose one out of the Northeast because I figured like I had been in the Northeast my whole life and I wanted to try to see what other places were like. The program that I also chose, the medical school, was in great proximity, like literally across the street to the engineering school, and the people there were back and forth, back and forth. So I had this idea in my head, like, oh, like there's so much collaboration. There's going to be so many opportunities to see how these things interact. And, maybe, if I don't end up applying to medical school, I can just have a job as a biomedical engineer. Like, I think that would be, I don't know what that's like. I think that would be cool. I mean, I got there and the classes were definitely another level of difficulty. I think grad school, the content is more advanced, but also projects become more group oriented. So you have to work with other people. Whereas in undergrad, it's kind of like every man for themselves. Like you have exams and you have to study and that's it. There's nobody else that you can rely on. But in grad school, you really do learn, like in the professional world, that you have to work on a team with other people. And there are a lot of different personalities and working types out there. I mean, this is not news to anybody. But that transition was probably, hard because I'd been on teams obviously with rowing, but it's a different context, getting work done by a certain deadline and so on and so forth. So that was a big switch. The level of content was a switch. The research was a switch. The lab that I went into was very rigorous in terms of, what projects they had and what work I would be doing. And it was cool. I was working under a pediatric pulmonologist. And so I got that insight into the clinical side of things and then how research from like a bench can actually feed into that. And that's where I was like, wow, okay, I didn't know that this really existed. And that's kind of where I started looking into, MD, PhD programs because I knew at this point, like, doing medicine and doing science was probably exactly what I was built to do. Like, I read about these programs, read about the type of people who go into these programs, and I'm like, that fits me to a T.
Yeah, that's fantastic. Thank you. How about the lab work itself? Do you find the lab components of graduate school any more, I guess, significantly interesting or different at all from the undergraduate work?
Yeah, so, I mean, I think I had a lot more independence in graduate school than I did as an undergrad. In undergrad, I basically met with my mentor every single day to go through what to do and how to do it and so on and so forth. Not to say that every single time I was doing anything, he was there observing me, but it was a lot more baby steps, hand holding. Whereas in graduate school, like, they teach you how to do something and then you just kind of go and do it. And I mean, I don't think everybody is necessarily independent from the beginning, but like I really wanted to emphasize my independence because I knew from undergrad I relied on that too much. So I wanted to kind of grow beyond that. And so I learned how to do histology and so on. So I did all that histology work by myself. The room that we did it in was completely separate. So I was just in there for multiple hours a day between classes in the afternoons and so on, just cutting up tissues and then running staining on them and so on and so forth. So I think that's the difference. I mean, if a master's degree versus PhD, though, is totally different. Like, master's degree, you're kind of just, you're in there so quickly that you're just trying to make a contribution and learn what you can in that short space of time, whereas a PhD is meant to train you to be that independent level scientist. So I think even then there's way less hand-holding, unless of course you have a mentor who is very, micromanaging. But of course, not having been to a PhD program, I don't know what that's like. I'm only repeating what people who have done this have told me and kind of what I've been able to observe by working in labs with PhD students. But I think it's the independence that's really the big difference.
Cool. Thank you. Real quick, 20 seconds. What is histology?
Histology is looking at tissues. Basically, you can take your muscle or your heart or whatever else, cut it into really thin pieces, put it on a glass slide that you can look at it under a microscope, and then you can look at its structure and whether there are proteins and stuff there that you want to see. That's histology generally. Histology is used in medicine too for similar purposes, for like diagnostics.
Perfect.
Hopefully that makes sense.
Yeah, absolutely. Thank you. All right. The next thing I want to do is talk for a couple minutes about specifics of the research in grad school, if that's all right.
Sure.
Yeah. So I found and read up on two of your papers. Yeah, there's one published in 2020 and the second was published in 2021. Both the papers focus on, let me get the name right. Was it
Pompe disease?
Pompe disease. Okay, I was not sure how to pronounce that. Thank you. So both of them talk about Pompe disease in mice, and with the eventual goal of studying it in mice to figure out how it works in humans. So the first was a literature review on, I guess, determining all the different impacts it can have on mice and like all the different health effects on different parts of the body, types of tissue it affects. Then the second paper was on quantifying its impact in mice. So looking at how much lysosome and glycogen buildup we get in different parts of the mice, which then affect the process of autophagy, which is cell recycling. Autophagy. Thank you. Yeah. Is that a good general introduction? Anything else crucial I might have missed?
No, yeah. I mean, lab I worked in focused generally on neuromuscular disorders and mouse models of those neuromuscular disorders, and particularly focusing on the respiratory phenotype and effects, because my PI was a pediatric pulmonologist who actually treated patients with these neuromuscular disorders. And as a pulmonologist, her primary concern is, lung function, because that obviously is her specialty. And it's a big source of morbidity and mortality for all these a lot of them are neuromuscular conditions, as these patients unfortunately succumb to respiratory failure, insufficiency, or their quality of life is severely impacted by how their disease affects the respiratory system. Basically, we wanted to measure if these mice were affected from a respiratory perspective, and then connect that dysfunction, if anything, or that lack of dysfunction maybe, with how the tissue looks, and then also how the nervous system in the mice works, because obviously breathing is due to innervation by your central nervous system. And a lot of these diseases being neuromuscular, they have both a neurological component and a muscular component. So the neurological tissue itself can be affected, and then also the muscle tissue itself can be affected. And then how they interact with each other is obviously affected. And that can manifest itself in respiratory dysfunction. So do these mice models actually recapitulate what we see in people? And if they do, how do they do that? And then how do we develop treatments, and what do we look for in a mouse versus a person? And, if they don't, then how can we improve the models such that they better recapitulate what happens in a person? Because there are a lot of therapies coming around for these things, and we need models to be able to test, is what we're developing going to be helpful for the disease?
That was much better intro than I gave, so thank you for that. Yeah, and one thing you mentioned that popped out at me from the paper as well that I found really interesting was the neurological component and the muscular components both contribute even to breathing. The breathing is not affected just by the muscular component. The brain is not receiving signals or sending out signals as easily, so it's not able to tell the muscles to breathe, in addition to the muscles themselves being impacted by the disease and not working properly. I just found that interesting, though.
Yeah, no, that's cool. I mean, Pompe disease is a specific example. There are a lot of other neuromuscular disorders, but they always do have those kind of neurological components, muscular components, and then also at the interface of the neuromuscular system, how the disease manifests. So it's pretty cool, Like Pompe disease, for instance, both the neurons and the muscle tissue itself have glycogen accumulation. But it's kind of, unfortunately, the synergy between how the neurons dysfunction and then also how the muscles dysfunction. And then those two things together is what leads to the severity of the condition.
Clarifying this in case it wasn't clear earlier, the worst part about this condition is the trouble that people end up having with the respiratory system. So the trouble breathing, which eventually leads to lower quality of life and in some cases death. Is that right?
I mean, yeah. I think a lot of people would also argue that it's the cardiac aspect too. Because especially earlier onset Pompe disease, these patients have cardiomegaly. So basically their hearts are enlarged. Because of glycogen accumulation, glycogen is a sugar, draws in moisture, and also it accumulates in the lysosomes because it can't be processed. That makes the heart tissue have to get bigger because there's more stimulus for it to try and meet the oxygen demands of the body. But obviously a bigger heart is less effective at pumping because there's so much muscle tissue. The heart can't even perfuse itself to be able to perform its function. But that is obviously also worsened by the fact that with the respiratory muscles, you can't open the lungs as well and you can't close them as well. So then there's less oxygen even coming in, which further increases the demands on the heart, and it kind of spirals there. I'd say it's the cardiopulmonary system is the safest way to describe it. It's the impacts on that, because it really is quite integrated.
Great. Yeah, that was so much better than the explanation I gave. So I appreciate that. So when you went into graduate school, had you already made contact with the pulmonologist? You wanted to work in that lab or in Pompe disease?
I got in and was looking to do research, and essentially the graduate program coordinator would periodically send out like, oh, this lab is looking for a master's student. And one of the first labs to reach out via this person was the lab that I ended up working in. And so I reached out to them. I was like, oh, I'd love to work on this, so on and so forth. And it's funny, she actually worked with my brother in the past. Didn't know that until we interacted with each other. But I think from then and there, like, just spoke about my general aspirations. So I'll figure out, I think I want to apply to medical school, and blah, blah, blah. She's like, oh, that'd be great. You can come and they already had projects set up for me. They had postdoc there ready to train me how to do the techniques. And so it was honestly kind of fell into my lap in some ways. And a lot of the other research that people were doing in biomedical engineering has to do with like computational things. Biomedical engineering is kind of an umbrella term. It encompasses medical imaging and, building software for medical applications. It also incorporates medical devices. So, like a pacemaker, even like an organ transplant, like all those things, all the monitors that you have, all the equipment that you see in a hospital, those are all built by biomedical engineers. But it also incorporates people who do basic biological research but use engineering techniques. So they might do like 3D cell culture or like building bioreactors and stuff. So it really is an umbrella term. And the lab I worked in, I was really happy to find this opportunity because it was clinically based and it was still rooted in the basic/translational sciences, and it wasn't about, building a medical device or like an organ on a chip, which is stuff that I'm not necessarily as interested in.
I love to hear about that stuff no matter what subject it's in. Even just reading your papers had me fired up again.
Nice.
Can you tell me a little bit about the research process transition from graduate school into the professional world and kind of how that process differs?
Yeah. I mean, I guess I can just say, I work actually in biotech. Like I said at the beginning, work in drug discovery/development for neuromuscular disease. I'd say industry, generally speaking, is different from academia in some ways, but it's really pretty much the same in a lot of ways. In terms of the work, the actual scientific work that's done, it's really not that different. Like you'll find people in academia who do drug discovery, but obviously they're not commercializing their efforts from the university. They do have to partner with somebody who has the know-how and the funding to be able to do that. But like the emphasis can actually be the same. It isn't so much that work that's done in an academic lab is that different from what's done in industry. We are doing all the same assays and we are looking at the same models. We do both rely on literature and we do both contribute to the literature. I'd say, I mean, the big difference is coming from definitely funding is obviously totally different. Like in academia, you write grants, you submit grants to various organizations, usually with an emphasis or an aim to achieve something, and then they might fund you or they might not fund you. They'll call for funding for a particular project, for instance, and then you submit a grant proposal to be funded for that, and you propose work. And then they give you a certain amount of money to do that work if you're so lucky. In industry, it's all about the product. It's all about getting a drug developed or whatever your modality is. It's getting it out to the clinic and eventually hopefully getting it approved for use in medical situations. So the funding is totally different. Obviously, you get funding from investors and not necessarily, you can, but not necessarily from like the NIH, for instance, like a lot of academic institutions rely on. And I think that funding does change the nature of what you do. It makes timelines a lot different, and it makes the experiments that you do a little bit more like kind of a scaffold than in academia. Academia, I think you have to get a little bit more creative, and then in industry, eventually you have to go in front of a regulatory agency. You have to be able to track everything that you do and justify everything that you do, and there's people looking at everything that you do and make sure that it's tracked and that it's well qualified. Has to follow these things called like good manufacturing practices or good lab practices. Those are specific certifications. So it's a little bit different from that. Like for instance, you run these studies in industry that you probably wouldn't really run at the same scale in an academic institution, or maybe you wouldn't even run them at all. You might run it as like part of a proof of concept, but you're not going to be systematically developing every aspect of it. Also, more commonly in academia, they use what are called like tool compounds, which are things that were previously developed that they just use as a proof of concept. Whereas in industry, you take those tool compounds and you essentially are trying to make a drug product out of them, like something that you can deliver to people.
Okay. Can you give us an example maybe of a tool compound?
For instance, like if you have a target in a disease, like let's just take Pompe disease as an example. Maybe you can develop a molecule that basically tamps down on, autophagy, for instance, inhibits the autophagy process. So you have to have some protein that you want to target that you can make an inhibitor for. And so generally speaking, there might be a tool compound, which is nothing that you would want to put into even a mouse model of a disease, but you know that it roughly hits that protein target with a certain potency, and you know that if you put it in there, it's going to have a relatively predictable effect. Where drug development comes in is taking that and making sure that it has good properties for when it goes into an animal like a mouse or eventually a person, that, it's going to hit the target tissue for a particular amount of time at a concentration that's going to be therapeutically beneficial. Most tool compounds do not meet that regard. They'll hit the target well, and they can be used as an initial screening tool, but they're not meant for being what we would consider to be a drug, if that makes sense.
Thank you for that. And how do you continue learning here in the professional world? Any sort of papers, any sort of online trainings, anything like that?
That's a great question. I mean, I'm constantly reading papers. I'd say a good portion of that is reading papers to be able to kind of make sure that whatever methods I'm following in my experiments are up to date and appropriate. Like knowing, okay, if I want to make a model of some disease process, how have other people done it? And can I model it myself here? Can I reproduce what they did? And if I can't, then how do I know what to change in order to make it more, physiologically relevant, for instance? So I'd say I continue learning by just constantly reading the literature. I'd say I'm learning from my colleagues who have different functions. So I'm exposed to things like in vivo pharmacology. So it's, I work completely on the in vitro side. So I work in cell culture mostly.
And what's in vivo versus in vitro?
In vivo means that they work with animals. We work mostly with mice. So understanding like it's totally different to dose a mouse versus dosing cells for obvious reasons. There are a lot of other considerations you have to take with an animal. Obviously, animal welfare and safety is primary, but also just like how you deliver it, how you formulate what you're going to deliver, how many animals you have per experimental group versus for me, it's like I put cells into a plate. I know based upon, different wells, I can treat in different ways. So I can have way more replicates. It's obviously a lot easier to have a more powered study from cell culture than it is for animals. So it's things like that. And then also maybe like medicinal chemists who basically run through and design all the new molecules that we're testing. And that's really cool to be exposed to because they run all these different tests about, get different parameters that are biologically important and that you really begin to learn how a drug is made. Like, what does it take to develop a drug? And I mean, I know I'm speaking in vague terms kind of because I have to, but that being exposed to different functions definitely teaches me a lot. I'd say though, like, in terms of fundamental biological knowledge that's important, it's like it's all self-directed. You just have to read up on it. I'd say more or less that's what I do, but also that's kind of why I'm applying for further education. Obviously, the education I'm applying for is a little bit of a switch, but
yeah. So I think that's a great transition then. So tell us about your next steps in education here. What's up next for Aidan in 2024?
Yeah, so I applied last year to medical school. I applied to a variety of MD and MD PhD programs. Had some interviews. Hopefully, we'll be hearing relatively soon about that final process. I know I want to stick with the research, but having the knowledge and the ability to treat patients is just such more, in my view, so much more dynamic of a job and so much more intellectually stimulating. Drug development is actually kind of like a very routine thing. I think I'm more interested in the basic science and the clinical care parts of it than the actual development process of it, if that makes sense.
Yeah, absolutely. Okay, so the schools that you applied to, the programs are primarily combination of MD and PhD, which is a combination of medical school and PhD in, is it going to be a PhD in medicine or PhD in biology? How does that work?
Yeah, you can do a PhD in pretty much anything. It's literally just like, it's medical school with graduate school kind of shoved between it.
Got it.
And that's not really, I mean, like there's more overlap. Like they let you have medical school classes count towards your graduate degree. Your graduate degree, usually has some relevance to medicine. So it's not like I go for MD PhD and then I go and get a PhD in English thinking about like, Victorian literature. If it has nothing to do with medicine, they're not going to let me do that. Most people, and what I would do is get a degree, get a focus in some kind of biological area.
Sure. And then, so the eventual goal of that, correct me here, is to be able to run your own lab doing research for medical processes. Is that about right?
Yeah, what my aspirations are now with the dual degrees is to be able to run some kind of clinic, have some kind of clinical presence, so that I can see firsthand, what is the unmet need that patients of a particular disease or group of diseases experience, and then use my research lab and my background to be able to develop treatments, especially for more rare diseases that a lot of industry, like commercial organizations, are not going to want to take the risk on yet necessarily. So I think what I would like to do is develop our understanding of a lot of these diseases from both a basic science and a clinical perspective, to be able to get it to a point where a company can't say no to developing a treatment for those people. Because there are a lot of rare diseases out there that, it's difficult to find patients. It's difficult to even understand the disease, not to mention developing a treatment for it. Because I know from speaking with people, it's like, just imagine how devastating it is. You have this condition, nobody knows what it is, and then finally you might get a diagnosis after 8 or 10 years, and then there are no treatments for you. And it's like, there are a lot of reasons why companies don't necessarily want to take on that risk, which I totally understand, which is why I think that I want to join in the efforts to be able to push whatever information we need forward to get to the point where whatever disease you have, there's an option for you. So that's what I want to do. And I think MD-PhD is really the most ideal path for that, because it trains you both as a physician and as a full-blown scientist. You really get that in-depth experience that the PhD provides you with. How do you design your own independent studies? How do you write a grant? How do you, get funding for an idea? How do you actually get the data, both from a technical perspective, but also from like a more kind of political, bureaucratic perspective, because that's part of it. So I think that's the best way. You certainly, obviously, if you're a PhD scientist and you want to take care of patients, you have to go to medical school. But there are plenty of physicians who obviously just go through medical school and never get a PhD, who are prolific researchers. I think for those people, though, the research, it requires a lot more years post medical school to just really focus on developing your research skills. Whereas obviously with the PhD program, especially when these are integrated together, it's a little bit more expedient, and you graduate with the clout rather than having to build that clout over time. So it makes things a little bit more straightforward in terms of funding. I think the dream would be to have a clinic, like there are clinics now for patients with neuromuscular disorders, where you basically just see people who have these conditions and you treat them, and then you can also run clinical trials, enroll them in clinical trials, do research studies, and so on and so forth. I think that's probably what I would want to be doing. Obviously, you have to be affiliated with a medical center to be able to do that. And the lab would have to be in an academic institution. It doesn't have to be, but it's probably the easiest path to be affiliated with like an academic medical center.
Cool. Okay, great. Yeah, that answered most of the academic stuff I had. What are some of the steps that you think you may have tried to skip along the way to get to where you are now and where you want to go in the future? Where do you think you may have gone down a path for a little bit of time and then decided that was not the best use of your time to get to where you eventually wanted to go?
Oof. I don't think I would have gone for my master's degree.
Really?
Yeah. I learned a lot, and I obviously got good exposure there. But I think I should have just kind of jumped into working, and it's hard. Like, yeah, I could have jumped into working, but would I would have worked in like a clinical setting or stayed in a research setting? I don't know. I think because I've wanted to go to medical school, there are far easier ways to follow a path to that don't involve what I've done. Because what I've done is very non-traditional, I think I've been met with some skepticism in the application process about my readiness for it. And so I really would just if I knew I wanted to do medicine again, which I feel like I would just do what works for people, because I know how I got to now and how I get to the future, but it's complicated, it's long, it's full of twists and turns, and I think medicine, they like people who are very, straight line, committed, direct, get the exposure you need, and then get in there and get trained, because it's a big investment. So I think I understand that they want to select people who they feel are the most committed to it. Whereas now, a lot of people look at me and go, "Well, you look like you just want to be a scientist. Like, why would you want to do medicine?" So I think if I were to go back, I would focus more on more really direct healthcare, medical related stuff.
Interesting. That was not where I expected you were going to go with this, because I feel like the graduate school helps so much in terms of preparing yourself for that PhD work and be able to run your own trials and run your own lab.
No, I mean, I know what you're saying. I think, absolutely. And that's why it's a hard question, because there are definitely things that I got out of my master's degree that I can't conceive that I would get it from any other experience. Like, if I had not done that at all and just gone and worked in a different capacity and then gone straight to medical school, like, obviously everything I've learned from my master's and now having worked in industry, I wouldn't have that knowledge. Is it maybe more of a struggle without more education and more time spent somewhere else? Like, yes, probably. But if you really are committed to getting to said goal, there are a lot of different ways to do it.
Cool. Yeah, I like that a lot. And have you ever thought about any alternative career paths, maybe if things have gone slightly differently in either, high school, college, grad school, any alternative career paths where you might have ended up?
If I, maybe if I had been taught like computer science earlier in life, I wouldn't hate it as much. My problem with it is I just don't find it super accessible at this point, and I find that there are enough people who have skills in it that it's like, if you want that to be done, like, you can just get them to do it. Now, I really don't like having other people do things for me, but at a certain point you do have to be able to have other people do things for you. So if I had earlier exposure to that, I wouldn't mind. I mean, I certainly also think I love weather. I think I would definitely do climate science, especially considering how dire things are. I would definitely want to go into that and contribute to that body of knowledge and try to find solutions, because obviously the time is now for that type of stuff. But I'm way too far gone at this point, obviously, to get into that. And there are a lot of people who are into it, but I definitely would have. I think that's something I would have realistically done. I can't really think of anything else, though. Like, never would do finance or anything financial. I don't care about that at all. What even are other jobs?
I don't know, anything fun, rowing coach or spearfishing or working a circus.
I mean, rowing coach. Yeah, I would absolutely be a rowing coach. I think it'd be fun for a long time. And you're helping kids and people become better. I think that would be fun if that could be realistically made into a career. I don't think a lot of people really can achieve that, though. Yeah. I'm trying to think of other things. I don't know. I really like science, so I definitely would stick with science. I think I would do different types of science, but I wouldn't do anything else. But yeah, rowing coach in the whole realm. Yeah, that was 100% something I would do.
And then any tips for people earlier in the careers, maybe people still in college or immediately post-grad, maybe someone who eventually wants to get into the MD, PhD. Yeah, I guess what are your tips for those types of people?
My tips would be open-minded, put yourself in uncomfortable situations, be constantly learning and growing, and be humbled, be willing to be humbled. There's nothing worse than somebody who's narrow-minded or has some preconceived notion about how things are supposed to be and follows that to a T and is rigid in their commitment to that. I think that that's really bad. Don't do that. Expose yourself to a lot of different things, a lot of different people. Listen to their perspective. do activities that, you're not familiar with, see if you like it or not, and then understand why you like it or why you don't like it, and just be very intentional about what you're doing. And at the same time, and not to sound contradictory, but like, be willing to be kind of led rather than you being, don't plan your life away. Like, be willing to have experiences that you didn't plan for, that just kind of happen to you and you don't really have a choice. Like, don't view that as a disadvantage. It's actually very much an advantage. It teaches you to be adaptable. I think that's pretty much everything I would tell somebody. Like, just work as much as possible to maintain an open mind about things. And don't develop an ego, and be nice to people. Be kind. You never know what anybody's going through, including yourself. So it's like, just, yeah, that's what I would say.
I love that. Even got a little bit of life wisdom at the end there. Great. Thank you so much for everything today. I appreciate it again.
Thank you.